buildup of energy in the body that's not discharged, that's not released, that's not heard. I mean, you can sit there and rant and rave at somebody to express a point, but it doesn't mean that it's being heard. But once it's heard, it's released, and you have a physiological release by getting it out and having it be heard.
Yeah, we should not internalize our emotions because it's self-destructive. I mean, literally, our chemistry is related to our feelings and emotions, and if we don't express it and get it out, especially the resentment and anger, then we're really attacking ourselves and hurting ourselves. And once you do get it out, then it's up to the other person what they can accept. I always say that the best doctors are criticized by nurses, patients, and family. And why? Because they are being helped by those people, learning from their mistakes, and they don't make excuses. So, if your patient knows that they can tell you something, like just a simple example, I walked into a room and a woman said, "What's wrong?" I said, "What do you mean what's wrong?" She said, "Your whole face is all wrinkled." I said, "Yeah, I'm really thinking about how to help you." She said, "Think in the hallway and smile when you come in here." You see, so that simple statement taught me something, about what it was like to be the patient, and so I could become better at it. I didn't make an excuse, "Oh, no, that's your problem. The other patients don't worry they know I'm thinking." Yeah, because if I would make an excuse or blame her, then she'd stop talking to me, realizing there's no point in telling him. But as soon as I'm willing to, and I've had patients tell me about my anger, and that's a part of me and my personality in the sense that I get angry when I can't fix and cure everything, You get so, and they'd say, "But you're taking out the anger on me." See, they would feel it, and I would always thank them, and and teach me to be a gentler person when I walked in the room instead of carrying that emotion with me, and they're feeling it.
Well, and, as energetic beings, we do feel other people's thoughts, feelings, and emotions.
Yeah.
We wear them on our sleeves.
I mean, consciousness is not local. That I know for a fact. So what we're dealing with is affecting others.
Mm-hmm.
Even on a simpler level, when I say that, you see, we have a house full of animals. If I decide I'm going to groom them, they all hide. See, they know what I'm thinking.
They know.
It's very obvious, yeah. When I say,
well, you're putting out that vibe, you're putting out that cleaning vibe.
Right. So off they go. When I give up, then they all reappear because they know I've said, it's getting late and I can't find them, forget it. Well, again, people may think all these stories are nuts, but there are two outdoor cats that live at our son's house. They're my animals that living in different places, but so I made an appointment to take them to the vet for shots. As soon as I made the appointment, they didn't show up for a solid week, for breakfast when you put the food out. And I called the vet. I said, "It's hopeless. I can't get them. I'm canceling. I won't be there." And as soon as I canceled, they were there the next morning waiting for a meal. And the vet was very nice. He gave me all the shots, and I gave it to them at the house. But it just was amazing to me, and no longer, because I've seen it in many other ways, with people as well, and our experiences, that our consciousness, I think, exists after even our bodies die, and is really what people describe as past lives. I think is just being aware of what has preceded us. So it's an amazing thing. And distance also isn't involved. I've had people find lost animals sitting in California, and the lost animals in Connecticut, and give you exact details about where it is so you can go find it the next day. And let me put it in a simple way. I believe what I experience. I don't get stuck on, can you believe this or believe that? If I experience something, I believe it. It's happened. It's real. Be that a medical therapy or something related to consciousness. Now, there are a lot of things I can't explain, but I accept that they have happened, and make them a part of my life. And I know a lot of physicians who say, I can't accept that. And what their meaning is, I can't understand it, I can't explain it, so I don't want to deal with it. But why not deal with it?
Even though they've had the experience.
Yeah, but why not deal with something that's therapeutic? You know, if it works and helps, hey, even if we can't explain it, let's not throw it out and deny it.
I find it interesting that medicine, especially there's been so much work in the areas of energy medicine, psychoneuroimmunology, your work, you know, which
Right.
Would that fall under the psychoneuroimmunology
I think
umbrella?
what I was thinking about recently, I got great criticism for saying to people, how do you benefit from an illness? What's happened last year or two in your life before you became sick? Now, why did I get criticized? Oh, you're blaming your patients. You're telling them it's their fault. No, I wasn't blaming them, but I was trying to get them to understand why they might be vulnerable at a certain point. See? But as a doctor, I was getting criticized by other doctors. Then I came across these statements by Nietzsche and Joseph Campbell. Nietzsche said, love your fate. Imagine that. Love your fate. And Joseph Campbell said, what he's trying to say is that no matter what hell you're experiencing, ask yourself, why do I need it? See? Now, they can say it, but I can't. See? Now, what I liked was that I was saying what these people I admire were saying to help others. But you see, when you're coming at it philosophically, psychologically, it's a lot different than somebody sitting with you with cancer. But the truth is, you see, which we can now show you scientifically, that if you're lonely, your immune function, the genes which control immune function, are suppressed by loneliness. Those are studies that were done. Or that cancer patients who laugh live longer. So you've got both extremes. So that's why it is significant to say to people, what's happened in your life? How do you benefit from an illness? I mean, you may use it to get attention, whereas you could use it in a healthy way to help you evolve, what I call turning a curse into a blessing. And when you say love your fate and why do you need it, you stop. And I've done this, believe me. I'm not just preaching a sermon. I mean, I've got problems in my life and my family too. So when I stop and think, why do I need this? Then I think about, why don't you ask yourself how to help this person, even if you can't make their disease go away? And then, the anger goes, and I get back to compassion and loving and helping the individual rather than getting angry at them for, not doing everything that's good for them and that type of thing.
So I'm going to give you a little food for thought, because you made the comment that, what was going on in your life a year or two before the illness developed. The work that I do, the primary focus of the work I do is I'm a medical intuitive. Mm-hmm. And when I work with my clients, I have a lot of people that come to me because they have something going on and they either want to understand the psychospiritual aspect of what's sitting behind the disease, or they go to doctors and the doctors don't know. They throw their hands up and, send them with an antidepressant.
Yeah, or give them a pill.
What I have found is that the reality is, in the overwhelming majority of people that I work with, is that something has happened to them either in the formative years of their lives or by their 20s. There is always some core trauma that will actually plant a seed, like a corn. There's a little seed, and then maybe a year or 2 or 5 years prior, there is something that actually triggers it to move into the physical body. Mm-hmm. And so when I work with people, I'll just sit there and look at their timeline